Welcome to NCLEX Physiological Adaptation questions. Test your critical thinking and common sense, how to understand whether a patient is dying or not dying. That's what I call it, be sharp. In this video, I have 10 high-yield critical thinking questions to mimic the way the NCLEX are picked. Main things they will ask you for you to learn how to recognize who is in danger and who is not. Stick around. Let me make this topic easily so that you will never go wrong with these answers. Which action should the nurse prioritize? You have to know we're dealing with situation involving emergency. Ask yourself, is the patient going to die right now? Is this life and death situation? Am I doing something first or best? And is the patient stable, or this is an expected finding? That's why I said be sharp. What is the situation? Which action should the nurse prioritize? That means you have 1 second. What would you do? Ask yourself, look at the situation. Is this a deadly situation or something you expect? A nurse is caring for a client 2 hours post-thyroidectomy. The client reports what? Difficulty breathing and a stridor. Buzzwords. Go for the buzzword. Common sense tell you, like, stridor sound bad. In my buzzword, there is an airway problem associated with what? Stridor. That means the airway is collapsed. Difficulty breathing. If you have 1 second, what would you do? This is classified as an emergency. You have no time. You want to save the patient. Common sense strategy with critical thinking. Like I said, don't make it difficult. The answers will look the same. But if you have to pick one, do you give the patient oxygen? Do you reassure the client and stay at bed? Or do you prepare for what? Tracheostomy insertion and elevate the head of the bed? What do you think? What are you going to do? What are you going to do? 2-hour post-thyroidectomy is airway obstruction. This may be what? Bleeding in the neck, and that is what is causing obstruction. We need to secure the airway. Oxygen will not go into the lung anymore because the airway is obstructed by stridor. That should be your normal clue, telling you this patient is dying. If I'm dying, oxygen is not enough, even through nasal cannula. If you reassure the client is dead, elevating the head of the bed will worsen the situation. They rather want to lay flat. This is not a lung problem. It's the what? Upper airway. That is what? The tubes bringing air into the lung. This patient needs tracheostomy. And so the key is to recognize what is the problem. Stridor post-thyroidectomy indicate airway obstruction from laryngeal edema and hematoma. So we got to evacuate it. And in the process, we got to secure the airway. This patient need what? Tracheostomy, right? So this is the way you should approach it. In all of the question, I will show you some of the strategy. But if you don't know how to answer, be sharp, check my prioritization. You have a breathing issue, electrolyte, shock, sepsis, airway, but be able to recognize who is in trouble. Ask yourself, life and death, is it first and best? Am I stable or unstable? And whether I have expected finding. So all of them, I will do the same thing. Which finding require immediate intervention. I need to act once. I have 1 second. And nurse is assessing the client with what? Severe pancreatitis. The buzzword is what? Severe pancreatitis. Bring your content. Ask yourself, when I develop pancreatitis, when it's so severe, what is the major problem? What is the major problem associated with pancreatitis that is so severe? If this is the pancreas sits here like that, it's surrounded by structures, especially vessels. When it gets severe, these vessels are going to rupture. You're going to have what? Periumbilical ecchymosis, frank ecchymosis. You're going to have airway issue. These are the two things you should worry about when it comes to pancreatitis. In that process, when they ask me, what is the immediate intervention? I'm going to be sharp and think critically and say, oh, common sense tell me if the vessels surround the the pancreas is going to burst, is going to bleed. There's some expected finding as you expect in pancreatitis. Great tenor sign, I don't expect it. Pain rating 8 out of 10, I expect it. Blood glucose of 180, I expect it. Serum amylase 420, I expect it. And no, physiological adaptation is what? Life and death. Therefore, immediate intervention require a life and death issue. What would you pick? I know you know the answer because you watched Adapting class. You're going to pick what? Great tenacity. That's your right answer. This is what the way you should approach these questions. Next question. What action should the nurse take first? First means what? You're doing something that is going to save the individual life. Best means the overall management. But this one is an emergency. A client with the chest tube to suction as a chest tube, that's a buzzword, underline it. Suddenly develop tracheal deviation, another buzzword, tracheal deviation. Tracheal deviation should be buzzing in your ear saying, I have a bad problem. Recognition of bad issue. Absent breath sound, another recognition of bad problem. Severe respiratory distress. What else do you need in this question? Nothing. I've given you the bad of all bad problems. Therefore, what action would you take? I'm telling you, patient is in trouble. Don't do anything that is not going to save the patient. That is all. The next first action, right? Call the provider. Can't you do something to save somebody who is dying? Increase the suction on the chest tube. Do you think suctioning the chest tube, increasing the suctioning in the chest tube is going to help this patient? If you think so, pick it. Apply oxygen via non-rebreather. Give the patient oxygen. Disconnect suction tubing. You know it's a bad thing. You need a chest tube. It has developed tracheal deviation, absent breath sound, and severe distress. Another way to tackle and think, common sense tell you, I have a big problem. Critical thinking tell you, this is what? Tension pneumothorax. How do you treat tension pneumothorax? Needle decompression. Needle decompression. You put a needle in the second intercostal space and withdraw all the air out. But there is no answer choice there about needle decompression. What do you think you should do? I can tell you, based on the diagram that we have, if this is the airway, one lung is completely collapsed. If this is the left lung, it's completely collapsed, basically, and we have tracheal deviation here. We got to do something. This patient is dying. The easiest thing you can do for this patient is to what? Needle decompression, but it's not there. Now, critical thinking telling you, calling the provider, you're not helping the patient. Increasing suction, you're going to worsen the situation. The only thing that will provide some help for this patient is what? Applying oxygen and giving the patient oxygen because that's what the patient needs right now. After that, then you do your needle decompression. If there's a choice there about needle decompression, that's what you're going to pick. Don't make it difficult. Just step back and say, I have to be sharp. At the same time, common sense tell me I got to save this individual. And I think critically, and I said physiological adaptation, they're testing you about life and death. This is what this video about. I want you to watch it multiple times. Then when you see these questions, you'll be able to answer them. Remember, 17% of your test is on this. This physiological adaptation has its own category. And it's very important as a nurse to be able to recognize these ideas. So what action should the nurse take first? Same thing. Okay, you tell yourself, I got to be sharp. What is the problem? Go over the buzzwords. Focus on the buzzwords. A nurse is caring for a client who has what? Spinal cord injury at T4. Something should tell you right away. A T4 spinal cord, most likely they're asking me about autonomic dysreflexia. The client reports severe headache. Is it not autonomic dysreflexia? Flushing of the face. Autonomic dysreflexia and sweating above the level of the injury. Oh, I know it. Critical thinking, autonomic dysreflexia, right? Now, you know what you need to do. You got to be sharp. Number one, be sharp means breathing, electrolyte shock, sepsis, airway. But I look at it, I said, this patient has ICP issue, neurological problem. Save them. And what would you do? Give them adrenaline to treat the blood pressure, elevate the head high follow position to help the ICP, check the bladder to prevent the stimulation, call the provider who will give you orders that you can do without not calling them. Common sense, right? I have ICP issue. Why don't you pick an answer choice that day with the ICP? Adrenaline treat the blood pressure. It does not treat the blood pressure, the ICP. High follow position will treat the ICP. What are you going to pick? I know you watch adapting class. Autonomic dysreflexia is hypertensive crisis. First, sit patient up to reduce ICP. This will also reduce your blood pressure. You may not need adrenaline. This is the way you answer these physiological adaptation questions. Once again, watch this video multiple times and learn all the strategy, and you're going to ace your test. The provider order, which provider order should the nurse carry out first? You have an option. You got to prioritize. Which of these will help the patient? Remember, we're dealing with life and death. If you die, what one thing will you do for this patient? Heart rate 140, heart rate, patient in shock, blood pressure 78/46, heart rate 128, and warm skin. This tell you is a septic patient. They've given you, I have sepsis patient who is in trouble. What would I do? If you watch my video, I go with the buzzword. I go with the buzzword, and the buzzword tell me shock, septic shock, an emergency. Why? Because patient is so hypotensive, tachycardia, and they have skin warm. That means severe vasodilation. Go for the buzzword. If you have to pick one word in this question, what would you go with? It depends on which one you focus on. If you focus on any other thing, you're going to go wrong. But if you focus on shock, you're going to get the answer wrong. It's an emergency. What is shock? Hypoperfusion. That means there is minimum flow of blood going to the lung. There's minimum of hypoperfusion. That means you need to improve intravascular system. That's all. That's all. Once again, increase intravascular system because it's shock. Which one? Drawing blood culture, I know is what? Septic shock. I need blood culture. Give them epinephrine. It will improve blood pressure. Administer 2 liters of normal saline, improving what? Intravascular system. Broad spectrum antibiotic will treat the what? Infection. But what? I have shock. I should treat the shock. I need fluid to improve the perfusion. What would you choose? I know you watch adapting class. In septic shock, fluid resuscitation always comes to restore circulation. Therefore, I'm going to pick fluid over anything. Blood culture, fine. I draw blood culture, I give them antibiotic. And if the blood pressure is not improving, I give them epinephrine. Which intervention is most appropriate? That means the best thing. And this is caring for a client with traumatic brain injury. He has ICP. His ICP is an increase. This is straightforward. It's not a trick answer. It's a common sense. You have a high ICP. I need to decrease your ICP. Then bring your content. Which of these will increase your ICP or which one will decrease your ICP? Hyperventilation, suction it frequently, keep the head of the bed at 30 degrees, increase fluid. Stop the video, think about it, pick an answer, put it in the comment, and see if you get it wrong. If you get it wrong, see the way I approach it. ICP, I need to decrease ICP. Hyperventilation will decrease ICP, but it's temporary. Suction frequently will worsen ICP. I should not do that. Increase IV fluid is going to worsen ICP unless the patient is hypotensive. They've not told me patient is hypotensive. Therefore, I'm not picking that. Now I have what? head out of the bed. It will drain blood from the brain and will help decrease ICP. So positioning at 30 degrees promote what? Venous drainage, and this lower ICP. You can see how I give you the concept and then use the concept to answer the question. So know the concept, and then you'll be able to answer this question. This is another one, strategy. What is the next best action? What is the overall management of this, which will improve the individual? It's not first action. A client with DKA has potassium of 2.8. Provider prescribed insulin. What would you do? Give them insulin as prescribed. Hold insulin and notify the provider. Administer insulin and potassium together. Give IV sodium bicarbonate. Something should tell you there's no patient who has DKA that come in with what? Low potassium. DKA patient, potassium is always high because of what? Because of lack of insulin, because it happened in type 1 patient. The reason why you treat them with insulin is because it's going to decrease their hypokalemia in the beginning. But this guy, potassium is already low. If you give them insulin, once again, if you give them insulin, this is going to drop all the way down. They will develop arrhythmia. So your content tell you that this is a bad thing. Insulin and hypokalemia cannot come together. This order is flawed. The nurse should act critically and say, if I give insulin, I'm going to get into trouble. Insulin as prescribed, wrong answer. Hold insulin and notify the provider. That's a good one. Administer insulin and potassium together, wrong answer. Give IV sodium bicarbonate. It's treating the DKA, not the hypokalemia. We are not treating the DKA. We're treating hypokalemia. Therefore, the right answer is what? Call the doctor and say, hey, do you really want to do this? And tell the doctor. So the nurse should question the order. Which action should the nurse anticipate? A client with what? Pulmonary embolism suddenly develop hypotension and tachycardia. What would you do? What orders? Prepare for thrombolytic therapy, administer furosemide, place the client on bed rest with the leg elevated, start continuous heparin. This question is straightforward, but you have to think critically and then use common sense, right? I have PE, pulmonary embolism, but what is additional information in the question? Hypotension and tachycardia. Hypotension means I'm getting into shock. Hypotension and tachycardia is shock. You don't have pulmonary embolism associated with shock all the time. When that happens, something is wrong. Patient is hemodynamically unstable, life-threatening condition. This is what the NCLEX is about. Physiological adaptation is life-threatening situation. I have the first thing to do is to save this patient. What do you think? Prepare for thrombolytic, give them furosemide, put them at bed rest, elevate their leg, or continuous heparin. Which one would you pick? Don't get trapped. Heparin is already past that stage anymore. Heparin will treat the what? Pulmonary embolism. But now I have shock associated. That means I have to act fast. Furosemide is going to make your shock worse. The third one doesn't help you at all. Remaining at rest with the leg elevated, you're improving blood flow. It sounds like it's good, but it's not helping, right? We have hypoperfusion, shock due to what? Pulmonary embolism. We need to remove the clot. The best tool to remove the clot is thrombolytic therapy. These are content to be able to use to answer the questions. I know a physiological adaptation can be very intimidating, but you need a little bit of content, some common sense, and critically think you said, I need to save this patient. The best thing to do is to provide a thrombolytic. So pulmonary embolism with hemodynamic instability is a massive PE. It requires immediate thrombolysis, which is ATPLES, which are thrombolytic therapy. So that's the right answer. And this is caring for a client with heart failure. Remember heart failure, right? The client reports dyspnea, another buzzword, as pink fluid sputum, another buzzword. And oxygen saturation 86, buzzword. I've given you bad problem. Pink fluid sputum means worsening of what? CHF. You have what? Problem with your CHF. Now you're drowning. If the patient is drowning, do you want the patient to die? Do you want them to drown? Pick an answer that will prevent them from drowning. Give them furosemide. It will take away the fluid, right? Place the client in high Fowler position with the leg dangling. It will improve the lung function now. Start morphine will cause vasodilation and help with the less blood flow to the lung, right? Notify the provider. It may give you more orders. But if I'm drowning, what do you think? Pick an answer and let me know what you think. Number 9, put it in the comment. Which one did you pick before I give you the answer? In this situation, patient sat is dropping, he is drowning, he has dyspnea. Improve the lung mechanism while you get ready to administer furosemide. The furosemide is not there right away. You may have to go get it. Even if it's there right away, it takes some time to work. Therefore, if you elevate the patient high Fowler, it will improve their lung mechanism, and that will help them right away. This is the way you should think when it comes to physiological adaptation. Life and death situation. We have a flash pulmonary edema. First thing you can do is positioning to improve oxygenation. Then you give them diuretic and morphine. But these are little things that it makes you get stuck with 1 or 2 answers. It's not your fault. It's the way you approach it. And the way you approach it, ask yourself, is this life and death situation? Is the patient stable or unstable? Am I doing first and last patient? And is an expected finding or an unexpected finding? Same thing. Post-op abdominal surgery, all of a sudden have tachycardia, tachypnea, chest pain, saturation 84. I don't expect this. This is an unexpected finding in the post-op patient. That means I have a life and death situation. I need to save the patient. What will you do? First thing, give them oxygen, call rapid response. Let the surgeon know, obtain ABG. ABG will give you information about the saturation. Notifying the surgeon, it will come to the bedside and help you. Call rapid response, another help. Oxygen, nobody is helping you. You're doing it. But what do you think? Which of these answers is better? Saturation is going down, tachypnea and chest pain. Critical thinking, tell me, I have what? I have what? Pulmonary embolism after surgery. Common sense, tell me, I should provide some oxygen to the patient before I call the doctor, because I don't need orders to put oxygen in the patient. Call the rapid response, they will come in. By the time they come in, patient is already getting oxygen. ABG will take time to run. What do you think? Number 1 is your answer. But this is the way you should approach them. Them question, critical thinking, using common sense, and close practice questions with answers. This is physiological adaptation for nursing school and for the NCLEX review. Thank you for watching. If you like this video, comment it. Let me know which question trap you. And then if you need more, subscribe to Adapt NCLEX for more content like that, or join our membership where we have videos that can help you pass your NCLEX and nursing school. But this is the way I want you to approach these questions. Thank you for watching and good luck in your exams.